The United States is the only industrialized country that does not provide universal health coverage. In 1965, the creation of Medicaid gave states the opportunity to guarantee health coverage for low-income children. The creation of the Children's Health Insurance Program made coverage available to even more uninsured children. By June 2013, the programs combined covered over 33 million children. In other words, 1 in 3 kids got coverage through Medicaid and CHIP. The rate of uninsured children has been cut in half, from 14% to 7%. But rising medical costs, dropping rates of employer coverage, and administrative barriers to enrollment have left the U.S. with an embarrassingly poor record of ensuring coverage for kids. Just a few years ago, 8 million children remained uninsured nationally, with 70% or more eligible for public coverage, just simply not enrolled. The Affordable Care Act offered the first viable vehicle for near universal coverage for children. As the challenges of the last year have shown, it's not just about getting the law signed, it's about implementing it smartly and successfully. Atlantic Philanthropies embarked on the KidsWell campaign, a multi-year project that supports advocacy organizations as they work to help implement healthcare reform and increase children's health coverage. Atlantic provided about $45 million to both state and national advocacy organizations. We targeted states with large numbers of uninsured children, and we created regional networks to ensure that grantees within the same state were working together and strengthening each other. Together, the state and national grantees set out towards a common mission to successfully implement healthcare reform and bring coverage to kids and families.
KidsWell's 7 states have helped ensure 5.7 million children and families, nearly half of the total enrollment for the whole country. We created permanent systems to get children enrolled in health insurance and keep them covered over time. We formed coalitions and partnerships, shared our best practices and resources, and strengthened our ties so that our shared mission could become a unified and lasting one.
The stakes were very high because of the enormous potential of the Affordable Care Act to improve health care for the families and children, to ensure that New Mexico sees the opportunity. We, the New Mexico advocacy community, needed substantial resources. AP put resources on the ground. AP approved funding. AP set up KidsWell so advocates around the country could learn from each other and from experts. AP made communications and organizing expertise available directly to its grantees. And AP funded national healthcare experts to get on phone calls with us and give us information, invaluable information. This was extraordinary.
I have to say, to me, the great opportunity, the greatest opportunity KidsWell gave us was to help close the information gap on the Affordable Care Act, which in many ways was as dangerous an enemy, as threatening and stumbling block as the Republican opposition in Congress.
Working with the youth and empowering them with the knowledge about the importance of being insured and planting that seed so they can go back into their respective communities and share this information.
But he be dodging bullets. His mom got no insurance. I wonder if you were me and I were you, would you believe in healthcare?
You need that ACA, big cuz where you stay, because I know that asthma killing within the feelings that you portray, and I can see it in your face. You be hurting every day, so living if you fall, ACA will help you up. How can you paint a brighter picture if you don't pick up the brush?
I went to Healthcare Connections and spoke with one of the navigators, and it made all the difference in the world. We were able to answer the questions that I had, and I also found out that my son was available for the M-CHIP program. I didn't even know the M-CHIP program existed. And this means that my son will not only have good health care, but he'll also have dental care coverage as well through M-CHIP.
The legacy lives in the collaborations and partnerships we've developed. The legacy lives in our children.
Through Atlantic's support, KidsWell has built a legacy of strong partnerships and strong families. but challenges remain. The future of CHIP is in question as Congress decides whether or not to reauthorize the program, and the success of the ACA is still up to us, the national and state partners, to see it through. We're encouraged by the work we've done, and we're excited about the future.
And a dream, I believe.